Hello, I'm Lucy Hubber and I'm the Interim Director of Public Health at Luton Council. I'd like to keep you updated on the number of cases of COVID that we have in Luton and share with you some important messages about what we can all do to try and keep the number of cases down. As you may have seen over the last few weeks, there has been a very steep rise in the number of cases. This is really worrying for us because we know that when case numbers get high, that's when we begin to see people who are more vulnerable becoming very ill and potentially dying from COVID. And very sadly, we have now begun to see deaths both at the hospital and in the community from COVID. Cases occur all across Luton. There's no one particular area that's more worrying than others. I'm going to start sharing this map with you on a weekly basis, and you'll be able to see where some of the numbers of cases are denser and that they move week on week. On the map, you can see that the darker colours are where this week we're showing a higher number of cases. What's really important to remember here is that high or increasing case rates in an area do not mean that anybody is doing anything wrong or that they're less likely to be following the rules. In Luton, we know that COVID passes between people between households and within households. So somebody could be following all of the rules, like the rule of 6 that we had before lockdown, but still be meeting with people from outside their household and picking up the virus that way. We also know that COVID spreads more easily in areas where people live very close together and where it's difficult to keep your distance from others in your household. People who work in jobs where they meet the public are also at increased risk. They might be doctors or nurses or carers or providing other essential services like driving buses or taxis or working in shops and restaurants. What is really important is that we remember the things that we can all do to bring those case rates down. At the moment, we're in lockdown. And although we can now go out and see one person from another house outdoors, we must remember to try and limit the amount of time that we spend outdoors with other people and stay at home as much as we possibly can. If we do go out, please remember to wash your hands or use hand sanitizer and wear a face covering as much as you can. We have to wear them in shops or on public transport, but think about wearing a face covering when you are moving around and you know that you might not be able to maintain social distancing. Following these steps will mean that we can bring case rates down in Luton and begin to see the numbers fall. Isolating at home can be really difficult. If you have any symptoms, no matter how mild, you should be tested and you should stay at home until you've had a negative test result. If you get a positive test result, you and the rest of the household will need to isolate for 10 days if you're a case and 14 days for the people who live with you. If it's difficult for you to isolate at home and keep away from others, please contact us. We might be able to offer you some support. And think about the things that you can do to keep safe at home. Don't share towels or tea towels. Make sure you clean bathrooms, particularly handles, flushes and taps. And try not to share kitchen space with others if you possibly can. If you'd like to find out more or get more involved, please join us as one of our community champions. As a community champion, you'll receive regular updates and briefings from public health experts and other people within health and social care. Just log on to our website, luton.gov.uk, for more information. Many thanks for all you're doing in our community. Together we can make a difference.